So my name's Joseph Manning. I am the Clinical Associate Professor here at Nottingham Children's Hospital. I'm also the Chief Investigator for the SAPhE Pathway Study that's being funded by the NIHR. So the SAPhE Study is a study that really aims to improve the safety of children and young people that are admitted to acute paediatric care in mental health crisis. So our ambition is to make children and young people who are experiencing mental health crisis admitted to our children's wards and the emergency department feel as safe as possible. And this study aims to develop a new technology where we will have evidence-informed risk mitigation strategies. So staff will be working with children and implementing these strategies to help them feel safer and help improve their health outcomes once they've been in hospital. So we found out a lot from this study. We've identified and got consensus from a whole range of stakeholders around what strategies should be implemented to keep these young people safe whilst they're in our care. We've also identified and done some work around understanding digital readiness and how we can implement this new technology across different organisations. And collectively that's enabled us to develop a specification for this new technology that can be adopted and implemented across different NHS trusts. There's been loads of people that have been involved in this study, and I think there's a real appetite and support nationally for this work. We've included obviously children, young people and their families as part of this work, and those people that have had lived experiences of a mental health condition. We've also included quite diverse stakeholders from healthcare professionals and clinicians as well as digital experts, and they've come together and given us real insight and information to really drive and develop this new technology so that we know that it's fit for purpose and it really fulfills the remit in trying to keep these children and young people safe whilst they're in our care. So the next steps of this study is to develop a follow-on grant application, which we're currently undertaking. And that really is to understand the effectiveness of those risk mitigation strategies and whether actually they do improve the safety of these children and young people. And also to understand the mechanisms of how we can implement this new technology into clinical practice. We're not at the end, and really we now need to go and test this new technology in clinical practice to understand whether it's effective and whether the recommendations around how we can implement that across different organisations are also effective. So I think children and young people's mental health is a public health epidemic, and we see a proportion of these children and young people that come through our care, acute paediatric care, every day. There's around 300 children admitted or come through the emergency department. And what we know is that they often feel very stigmatised, very frightened, and can have thoughts and feelings that about harming themselves. And so we need to, as health professionals, as researchers, ensure that we are providing the best quality care to them to enable them to feel safe and to have the best experience and outcomes. So we have an event in May that's really a culmination of the study and really an opportunity for us to celebrate and come together as a wide group of diverse stakeholders to understand some of the national and ever-evolving context in which we're delivering and supporting children and young people's healthcare, but also an opportunity for us to disseminate some of the work that we've done and some of the stuff that we've found. So you can find out more information about this event through our website, and we are wanting a whole range of diverse stakeholders to attend. Ideally clinicians and digital experts, but anybody working in the emotional health and wellbeing space for children and young people are invited to come and participate in the day. Yep, so we have a website that we update regularly with new developments with the study, and we will be updating that over the coming weeks and months with the findings from the study. So please do access the website. There is information for a whole range of stakeholders available on that, including children and young people. So please access it. It's a informative, accessible platform where you can get up-to-date information about the SAPhE study. I've been overwhelmed by the tremendous support that we've received locally and regionally and nationally for this study. I think there is a clear commitment from all stakeholders that we need to support children and young people and their emotional health and well-being. And this study is a part of a bigger puzzle in enabling us to achieve that ambition.